I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. Hi, I'm Tamara Thomas, editor-in-chief at Urban Health Today, and I'm speaking with Bronwyn Spira, founder and CEO of Force Therapeutics, a platform that delivers video-based education and exercise to patients. She's also a physical therapist, and she's here today to talk about the challenges disadvantaged populations face in accessing orthopedic surgical care, the consequences of delayed care, and expanding access to care using virtual tools. So thank you for speaking with me today, Bronwyn.
Thanks, Tamara. So good to be here.
Awesome. So let's get started. Can you tell us about your background and your work?
Sure. So I'm actually a physical therapist by training, and I spent almost 20 years in the clinical space treating patients, all types of patients in all types of settings, and really came to deeply understand the challenges my own patients were having with recovery and rehab, as well as my own challenges around data, and really getting visibility into the patient's journey and where they were when they were outside of my clinic, how they were feeling, how they were doing, how they were coping. And so, in my most recent clinical role was running a private practice, outpatient and sports medicine practice in New York City. I decided that with the advent of technology and, smartphones becoming much more ubiquitous, that this was an opportunity to explore how we might introduce a technology to improve the patient experience, but also improve my own access to understanding their journey, their recovery, their data. And so really started Force almost like a side project, a bit of a passion project, to help my patients improve that experience.
Those are always good. Can you give us passion projects? I mean, those are always when they come from the heart. Can you give us an overview of the existing disparities in the orthopedic space? We don't really hear a lot about that. Which groups are most affected?
Well, I think everyone's affected. So musculoskeletal injuries and incidents actually impact more than 60% of the entire adult population. And, if you think about it, most everyone has a back injury or knee injury or something that impacts their ability to live their life and impacts their ability to do the things they love, play the sport they want to play, go to work, pick up their kids. And it's also the leading cost driver of global healthcare spending. So it impacts everybody equally. The disparities come where we think about the patient's ability to access and understand the care that they need to get better from that MSK injury. And then also, some people are less able to access that care in a timely manner, and that impacts how quickly the intervention, can kind of take effect. And obviously earlier intervention leads to a better result. So it's really just that access piece that is where the disparity lies, in my opinion.
So as far as access, what sort of lack of access are you seeing?
That's such a good question. And, it really can vary, but access, I broadly define as access, physical access, right? So patients that cannot get to care due to transportation or weather or a good bus route or, time, so that's like physical access. They can't get there. Then there's economic access. They can't afford the care they need. They can't afford their copays. They can't afford the Uber ride because there's no bus service. So that's that economic access piece. And then there's this intellectual access, which I think is so important and underrepresented in every type of healthcare disparity conversation, which is, not everybody is kind of educated in a way that they understand their body. Not everybody has the same level of education. Not everybody understands the same language in the same way. And healthcare jargon can be very confusing. So if a person does not understand the type of care or the information that's being given to them, that is an access issue. They will not be able to create the type of care program that they need to improve. And so access takes on many, many kind of personalities. And for me, I really think it's so important that we have to think about all of them. Because it really has a huge impact on overall health for patients. If they don't address their MSK issues, that leads to other potentially more, definitely other different types of morbidity and mortality, diabetes, high BMI patients, inability to go to work or create a paycheck, so it really has very far-reaching effects. So lack of access can really be kind of in the center of multiple healthcare issues for many patients.
And MSK, that means musculoskeletal, right?
That's correct. And it's like any joint, muscle, tendon injury, anything that affects the physical body is kind of under the MSK umbrella.
So in your white paper, you talked about the low acceptance rates of Medicaid and Medicare among orthopedic surgeons, which that was shocking to me. I didn't know that. Why is that?
So, I think in a lot of cases, surgeons feel that their reimbursement rate, as well as the documentation burden placed upon them by CMS, are not sustainable or advantageous to their bottom line. And, if they can do the same surgery and get paid better and quicker, with less paperwork, they oftentimes have no choice but to stop accepting Medicare and Medicaid as payment for their services. And this impacts especially, surgeons in private practices, providers in private practices who have large and growing expenses that are required to run their practices, liability insurance, staff costs, security, health benefits for their staff. And so a lot of times they're running a relatively low margin business. And so it may not make sense for them to accept the insurances that, create, barriers to their reimbursement and their bottom line. And the other point is really that CMS, the largest payer in the world, is very highly regulated. And, it's like turning a large ship. If you have an ocean liner, you kind of turn the steering wheel slowly and the ship turns very slowly. So less ability for them to be agile and turn on a dime, whereas some of the commercial payers and the self-insured employers are able to actually be a little bit more dynamic in their approach to reimbursement. So I think that's really where that comes from. And it's, it's unfortunate, but it's a business decision that a lot of practices just have to make.
And then that ends up affecting the elderly and the underprivileged, obviously, because a large number of them have Medicare. Now, do you know if the managed Medicare, because a lot of it is managed care now, are you finding that, or have you seen in your experience with this, have you seen any differences in terms of we'll accept certain types of managed care versus others, or is it just blanket?
I think it differs by market and by care plan, and I am not familiar enough with all of the ramifications, but in my mind, it just creates an additional blocker, an additional access challenge, and in a world where we want to really reduce barriers to care, as much as possible. Adding insurance coverage as another access barrier just doesn't seem like we're going in the right direction.
It's funny because I broke my wrist several years ago, maybe about 6 years ago, and I went to an orthopedic surgeon's office, and his office was jam packed, and they couldn't all be, or maybe that's just a New York thing. I don't know. And in any event, it's just shocking to hear that number, that such a high number of them are not taking Medicaid and Medicare. When in my mind, it seems like these offices are like filled to the brim.
And that's a good point. I think that the need for orthopedic care is large and growing. So there's no shortage of patients, which means that providers are able to make that choice,
Yeah, that makes sense. Mm-hmm. Do you think that government intervention is warranted or would help this, or?
I definitely think so. I'm a provider, so I take everything from the clinician's perspective. But, my opinion is that when the government makes changes, and they do need to recognize how healthcare delivery is changing, they need to create and prioritize incentives that benefit those that are providing the care. So the providers, from the surgeons, the nurses, the PTs, the PAs, those people providing the care really understand how things need to change, and should really be central to that conversation. And so at the same time as there's new shifts in healthcare delivery, there's also an incredible opportunity that's in front of us, which is access to data. So, for example, CMS, which is that huge, the largest payer in the world, actually, has issues, being very dynamic in the way they approach reimbursement. They also have an opportunity in the fact that they have access and visibility across these huge data sets. And what's so interesting and exciting in this new changing world that we live in is we can use that data to improve care delivery. But it has to be centered on the providers. And, so that's, I think for me, that's just there should be change. It should be progressive. But it has to take into account the ones that should be benefiting the most in a way are the ones that are actually delivering that care.
So do you see a space for value-based care as helping move these disparities, moving to a better place, moving across the goal line?
Definitely. I think there is a lot of waste in the system, and there's a lot of overutilization of services that are not actually proven to create a better outcome. And to be honest, the focus on understanding outcomes of care is recent and all driven by value-based care. So I think it's absolutely imperative to think about the end result and the quality of care delivered in order to mandate how care can be delivered and should be delivered. But it's really removing that unnecessary overutilization, where I think value-based care is, super valuable and 100% focused on the right things. It's just more, the concept is good. It's the execution that I think is, still needs some work.
And you lay out some suggestions in your paper for how access to care should be approached to promote greater health equity. So I encourage people to, take a look at their paper. Disadvantaged patients are also experiencing complications and readmission, though, after some procedures. Can you talk about what's happening there?
Definitely. And really, it's all about access to education and the right education. So I can give you an example, and just to illustrate the point here, that one of the most common complications after a total joint replacement surgery, for example, a knee replacement, is a surgical site infection. And that is something that's very preventable. But oftentimes patients are sent home from the hospital without adequate information and education around how to care for that wound so that it does not get infected. And this is, again, where some of those disparities come into play, and social determinants of health are such an important component of thinking about how we educate patients. So if a patient's well educated in how to care for their wound, how to, prevent that infection, they may never have an infection, they won't go back to the emergency room, and that whole episode of care will be less expensive with a better outcome. And that's value-based care in a nutshell, right?
Right.
So really, in my mind, the ability to educate patients in a way that is digestible by them is a very important factor that we all need to think about and we need to execute against in order for true care to be delivered in today's healthcare paradigm.
So what does that education look like? So I'm a patient.
Right. So there's multiple considerations that you have to. So, for example, Force is a platform that educates patients when they're out of the purview of their provider. So before surgery, getting them prepared, helping them understand what they're about to go through, and then after surgery, in a stepwise sequence, all the things that they'll need to know as they recover from that surgery. So the education needs to be in a format that the patient can understand and relate to. So for example, video is very, very powerful. We use video as our main medium of education, and it can't be, 90 minutes long. Really what we have to do, and it's a science and an art at the same time, we have to understand, a patient's attention span for this type of very intense information might be 90 seconds. So we have to figure out, well, how do we get the most pertinent information into a format that they can understand in the first 90 seconds of the video? And then how do we make sure that they get to come back to it again and again and again? Because again, like that, you have to think about the retention piece of absorbing education. So that's just kind of one of the things that we have to think about. The other thing is obviously language and education level. So whatever information we're delivering needs to be accessible to whatever language that patient speaks, and it can't be their second language, because remember, healthcare terminology is tricky. So if your English is a second language, there's a lot that you could miss in an education video. So of course we have all of our videos, and our whole platform is actually available in Spanish and other languages, so that we know that the patients can actually truly understand it. And then the ability to give that patient confidence that the education that they're receiving is coming from their own care provider. And I had this challenge myself when I was in practice, because my patients would come to me and show me a YouTube video or a WebMD article, and those may be great videos and great articles, but for somebody completely different than they were. So for me, a very important piece of education is making sure that it comes from the actual providers that provided your care.
The videos come from the providers.
Good question. So we at Force, we make sure that what we're saying is exactly what the providers would say, and we have research behind everything that we have in our system, but it's configurable. So for the most part, a provider will look at the set of videos that will be delivered to their patients and say, I want this one at 3 weeks, this one at 5 weeks, this one I want to change this last sentence. So it's about 90% there. And it shouldn't be too variable, by the way, because variation increases cost as well. different conversation, but also important. But we really want to make sure that once the patient receives that information, it's the right information that has been blessed and kind of signed off on by their own provider care team. So there's a lot that goes into creating that experience, but it really has to be very thoughtful around what can the patient access, what can the patient understand, what is the right kind of level to pitch this information in, and then engaging a care provider if that patient is still unable to receive that information, making sure the care provider is engaged before the surgery so they also know what to expect and how to support their loved one. So, there's a lot of elements, but luckily the ubiquity of technology and the ability to actually deliver this type of information, I think is, transformational to how patients recover today.
What kind of patient feedback do you get that tells you that this is working and effective?
That's such a great question. And, when you develop a technology like ours, it's an enterprise level technology. So it's, very robust. And we constantly poll our patients, we do an NPS score. We ask them if they say less than 10 out of 10, we call them and say, well, what didn't you like about this? How can we improve your experience? And we have a lot of data, even just from knowing when a patient engages and when they fall off the platform. And so we use all of that rich data. So it's qualitative and quantitative data to inform our product development. And it's never done. It's never static. We're always thinking about iterating and improving that patient experience, and everything for us, at least as a company, is patient-centric. So it's all about that patient experience, because we understand very well that if the patient engages and has a positive experience, their outcome will be positive.
Yeah, exactly. So disadvantaged patients are also they're not coming back for the care. There's the matter of delayed care. So can you talk about some of the consequences of these delays in care? Like, what's going on there? Is it comorbidities? Is it they're not comfortable with the provider? What's going on?
So there's often an education gap, and there's the fear is a big thing, anxiety. What does this mean for me? How will I, how will it turn out? And that's really an important aspect of educating patients in a way that they understand what's about to happen to them. And some of our providers use our platform to actually have that conversation with their patients and say, out of my 150 patients that I've seen so far this year that had exactly the same procedure as you, 149 of them are now walking and normal and no pain. And, and the one patient, had a problem, but here's how we fixed it. So it's really encouraging that patient-provider communication and showing the patient data and information that gives them comfort and, reduces their level of anxiety going in, so that they don't delay and think of excuses why not to have a surgery that can be incredibly impactful and improve their quality of life.
And how does Force counter these delays in care? Do you send out nudges, notifications, or?
Absolutely. So we have a lot of tricks and tools we use. We have a lot of gamification so that patients get rewards if they do what they're supposed to do. When they reach a goal, for example, they get a big confetti on their screen. And so they're constantly being encouraged to follow their plan, their care plan, and to do the things that their care team is recommending. And so it's this constant encouragement, positive encouragement, constant engagement, and, making sure that they're, that we use the data that we have to support their care experience. And I'll give you an example. Patients are typically very afraid of pain, and that's normal. But they worry that after surgery, they're going to be in much more pain and it's going to be intolerable. And so being able to show them, de-identified data, obviously, but, these pain graphs that patients have where, they may have been a 9 or 10 out of 10 before the surgery. And sure, for a few days after the surgery, they're going to have some pain. That's normal. But then you'll see how this graph goes down and down and down until, 1 or 2 weeks later, you're at a 3 out of 10 or a 2 out of 10. And that is really when patients are presented with data, it helps them really understand the impact that this is going to have for them. So that really helps engage them in the process, holds them accountable. If you do these things, if you follow this plan, you can do really well. And hearing that from a provider, I think, is the most powerful thing. We're just the conduit for that message. We allow the provider to share that with the data behind it. But it really has to come from the provider and not from an anonymous source. And that really helps the patients have a positive experience.
I'm curious, what happens in a situation where there's a medical desert? So there's no orthopedic surgeon for miles and miles, maybe your entire county or, parts of your state. Is that something Force can step in and help with, or no?
Absolutely. I mean, we can't do the surgery remotely,
Right.
but we can absolutely take care of everything separate and apart from that. So we create the preparation, the education they need to get to the point where they have the surgery, and that's everything from certain medications they have to stop. They have to prepare their skin in a certain way with, antibacterial wipes. Oftentimes they have to, some surgeons recommend they drink a drink to help them recover better. So we take care of all of that, so that when they arrive at the surgery, they're ready, they know what to expect, and then they're in that surgery a couple of hours oftentimes. And then they go home and everything else is housed within the platform. So education on, how to care for your wound, as I said, what exercises to do, what things to avoid, how much should I be walking at this stage, what device should I be using, what food should I be eating? All of that is easily taken care of in an interactive technology like Force. And so we really build that holistic care plan that, it can't just deal with one aspect of recovery. It's the whole patient that has to be managed, including things like, the importance of sleep and, calm, relaxation, meditation, anything that the patient could be experiencing, they can actually get from the platform without having to travel 45 minutes. And interesting, we did a study with one of our health systems that has a very rural population. I think the average time that a patient has to drive to get to the main hospital is 45 minutes. And some live as far out as 2 or 3 hours. And our research showed that the patients that lived the furthest from their anchor hospital, so those living 3 hours, were actually the most engaged in the technology platform. And they just understood that if they did everything that was set up for them to do, they wouldn't have to come back to the hospital. And so that was a motivation in and of itself for them.
So you work in concert with the providers always. Do you ever have PT-led teams, or is that something?
Absolutely. Yeah, a couple of times in our care team structure, the PTs are the ones leading the navigation of that patient. So they understand exactly what needs to be done, what needs to be tweaked. We also allow for real-time telemedicine visits. So if a PT, for example, needs to actually see how a patient's doing directly from the platform, they click a button and they can launch that live visit, which, by the way, in some cases now is reimbursable by Medicare. So they are, coming to the table to some degree. But, I think that that's really the ultimate combination of this asynchronous but synchronous communication that is really so powerful to help patients feel supported and get them better.
So circling back to the Medicare and the Medicaid gap in this, I'm just wondering. So if the surgeon does not accept the Medicare and the Medicaid, um, you obviously have patients that are falling into this gap. How does Force help with that, with bridging that gap?
So that's a great question. I think if a patient ends up having a surgery and paying for it out of pocket, which is certainly not a good or ideal situation, but in the case where, they don't have outside coverage, then all the additional expenses are taken care of. So they wouldn't have a copay for PT, they wouldn't have to drive or travel, which is an added expense. They wouldn't have to take time off work, which is an added expense. And potentially by using this platform with this protocolized care plan, they could potentially, get better without leveraging any other healthcare dollars and still get to a good result.
In your paper, you talked about virtual physical therapy and how it can help patients improve outcomes. Can you elaborate on that?
Yeah, I think, a lot of times the outcome of a surgery depends a lot on the aftercare. So how the patient becomes mobile, how their range of motion progresses, how much they're able to strengthen their joint or their knee, whatever the surgery was. So physical therapy is key in getting that patient better because it teaches patients really how to move, how to exercise, how to strengthen their joints, and how to improve their range of motion and return to normal activity. But in the case where patients are unable to actually get to an inpatient physical therapy clinic or an outpatient physical therapy clinic or get physical therapy to come to the home, they can do most of the stuff is really doable through an exercise program. And so what we do at Force is we deliver the care they need, the exercise plan, through these video-based exercise protocols. And it's designed to progress as the patient progresses. And again, we always like to work with our provider organizations to understand exactly what type of care they want to be delivering. And oftentimes we're working very closely with a physical therapy department to create those plans of care. And then, they can pop in there and adjust them and intervene as needed. But, that virtual piece is very, very important so that patients become active quicker. And that really improves their recovery.
So does the orthopedic surgeon practice sign up for Force? How do you access that?
Yeah, so we sell the platform, which is sold on a per care team license to health systems, private practices, ASCs, which are ambulatory surgical centers. Anytime where care is being delivered by providers, they can engage with us, purchase the platform, and then use it with their entire patient population. So they basically purchase the license, and that gives them the license to deliver the care that they would have delivered, but do it virtually.
That sounds amazing. And what kind of coverage do you have across the US?
We are in about 70 centers around the country. And we typically, started out with a lot of the academic medical centers just because they are, oftentimes thought leaders, and they're kind of thinking through data and research, and this platform obviously delivers that. But we've grown a lot, and we now work with any kind of musculoskeletal provider, whether it's a private practice focused on orthopedic care or an ambulatory surgical center. That is really, for them, it's really important that their patients come in and leave on the same day, because there's no overnight opportunity. So we really have to take care of that preoperative and postoperative patient experience, understanding that they don't have a lot of time inside of a hospital setting.
Now, are you able to, off the top of your head, and if you can't answer this, that's okay. Are you able to quantify the improvement in average patient outcomes using a platform like Force in concert with orthopedic surgeons?
It's a really good question. And the reason that that's a hard one to answer is
I was just curious.
pre-Force, there were no real benchmarks that our providers had necessarily, because they either didn't have a good way to collect those outcomes, or they were doing it on paper, or they were not getting enough of a cohort size to actually benchmark their own outcomes. So we can tell you where they are, but we can't tell you where they've come from, which is an interesting problem. And to me, just the fact that they are now collecting through our platform 90% of patient-reported outcomes is an incredible feat in and of itself. So that is some kind of a benchmark, right? From 0 to 90%, or in some cases, 15% to 90%. So that's pretty impressive. But I think that the really good question, which is the one you asked, is, how much has this helped improve outcomes? And I think, just from our own anecdotal experience, it's night and day, and especially understanding how patients are much more engaged, much more accountable, and they're empowered to do the things that they need to do to get better. And it's that in and of itself is a much more holistic and valuable care experience.
Well, what are your providers saying about it? Is it lightening the load for them? Is it making them easy to manage their patients? Or what kind of feedback are you getting from the providers?
It's become, in many cases, their operational, kind of scaffolding. So a lot of our providers will say, we couldn't do what we do anymore without Force. And they rely on it as a construct in how they care for patients. So it's really become a vital part of how they practice. So that's the kind of the infrastructure piece. The other piece that they love is the access to data, because they get on their dashboards, they can access their patients' data just with one click of a button. And that, for some providers, is very eye-opening. Some of them have never seen this type of data before. And it's not just the outcome measures, it's the pain, the sleep, the activity levels, the patient satisfaction. Patients write all sorts of love letters about their care experience. And, for providers to see that is very powerful. And then I think the third very, very important thing in today's day and age, with what we're facing with workforce challenges, is the ability to scale their care teams. So, giving their nurses and their navigators and their PAs tools that make them more efficient in their day-to-day. A lot of our providers, our organizations, are losing nurses. It's really hard to replenish those last FTEs. And so really being able to reduce the burden of care on their nurses and their physician extenders, their administrators, their medical assistants, that to them is really, really valuable. And if you think about it, every phone call that a nurse had to make that used to take 30 minutes is now an automated outreach through a platform. Even that in and of itself is incredibly valuable as you think about how patients and people spend their time every day.
But patients are still able to talk to a live person.
Yeah, absolutely. But I think what is happening is because we know typically the questions that patients ask, we can be very preemptive and predictive in the type of information we deliver. So if a patient, we know that a patient is going to ask, they want to call their nurse and say, my knee looks really bruised. Is that normal? And what we can say is, here's a video explaining to you why that's happening, how it's normal, how you can expect that to change over time. And suddenly their need to call their nurse disappears. They have the answers to their questions right there.
Wow, this sounds amazing. I hope more orthopedic surgeons take this up. And I really hope the government steps in and does something about helping with more coverage, because I do worry about those populations not being able, because of the comorbidities you talked about, not being able to, get access to this care, because it sounds like without the provider, it almost kind of sort of doesn't happen, right?
Yeah, I think, using technology for good, and we think about Force for Good, we call our platforms called Force Therapeutics. So using technology as a force for good is really, the way of the future. And as long as it's done in a way that's responsible, based upon data and outcomes, and provider driven, I think, it's a win-win. So hopefully more and more surgeons, as you say, and certainly more and more payers are paying attention to these trends and are actually incentivizing this behavior in the right way.
And hopefully as value-based care becomes much more prevalent, we'll see more changes and more quantifiable. Like, you're already leading the charge, right? But with value-based care sort of taking up the fight, I think there'll be much more data available to really, you can then take this, to the government and say, hey, this is what we're able to accomplish. Will you help us? Will you help us with this fight? Bronwyn Spira, thank you so much for your time. Thank you for your work. And thank you so much for your time today. I really appreciate it. This was really encouraging and edifying.
Thank you so much, Tamara. Great chatting with you.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.